What questions should I ask a mastopexy surgeon? Thinking about a breast lift can be exciting, but it's important to ask the right questions to make sure you're fully informed. When you meet with a plastic surgeon about a mastopexy or breast lift, you want to understand the procedure, risks, recovery, and the surgeon's experience. First, ask if you are a good candidate for a breast lift and why. Find out if any health conditions might prevent you from having the surgery. Ask which specific technique they plan to use and where they will place the incisions. It's also helpful to know if the procedure will change the size of your breasts or just lift and reshape them. If you're considering other procedures like breast augmentation or reduction, ask if combining them is possible and safe. Request to see before and after photos of previous patients to get an idea of the results you might expect. Next, inquire about the surgeon's qualifications. Confirm if they are board certified by the American Board of Plastic Surgery. Ask how many years they have been performing breast lifts and how many procedures they have done. Find out if they will perform the entire surgery or if parts will be delegated to other team members. It's good to know if they work with the same surgical team for each procedure to ensure consistency. Discuss potential risks and complications. Ask what common issues can happen and how they handle complications if they occur. Also, consider asking about non-surgical options or less invasive procedures that might be suitable for your goals. For anesthesia, ask whether they will use general anesthesia or local anesthesia with sedation, and how long the surgery typically lasts. Find out where the procedure will be performed, whether in a hospital, outpatient center, or their surgical facility. Recovery is a key topic. Ask about the expected timeline for healing, when you can return to work and daily activities, and if you need to stay overnight after surgery. Clarify what postoperative care will involve, including bandages, support garments, and follow-up visits. Ask how long it usually takes to see the final results and if they will improve over time. Inquire about steps you can take to promote healing and reduce risks. It's also important to ask if the surgery will affect your ability to breastfeed or become pregnant in the future. Financial questions are just as important. Ask for the total cost of the procedure, including surgeon fees, anesthesia, facility charges, and post-op care. Find out if pre- and post-operative appointments are included in the price. Ask if insurance might cover part of the cost under certain conditions, and if financing options are available. Finally, consider practical questions. Ask how long the results typically last and what factors might influence their longevity. Find out what options are available if you are unhappy with the results. Request testimonials or references from previous patients if possible. Asking these questions helps you understand what to expect from the surgery, the surgeon's expertise, and how to prepare for a safe, successful outcome. Remember, always consult with a qualified healthcare professional for personalized advice tailored to your individual needs.